The Prime Minister has flagged a raft of potential changes to Medicare with the aim of expanding access to primary care. While the finer details are being considered, some of the practical changes could see nurses and paramedics asked to help out by providing scripts or at-home care. For more on this, let's bring in Dr. Danielle McMullen. She's Vice President of the AMA. Dr. McMullen, thanks for your time. In your view, what needs to be the priority of any reform here of Medicare?
So the priorities are really twofold. We heard the Health Minister in his address today talk about what the state of crisis is in general practice and how far behind the cost of providing care that Medicare rebate has fallen for patients. So on one hand, we really need to strengthen the system we have and make sure that patients are getting adequate rebates back for seeing their GP. But we also recognise that with the increasing burden of chronic diseases like diabetes, heart disease, and our ageing population, we also need to see changes in the way we provide some healthcare and using that supported team like nurses, dietitians, podiatrists, and providing some flexible funding to GP practices to be able to employ the team to help them work to their best effect and give patients the best possible care.
Do you see a role as well for, I know you mentioned a couple of medical professionals there, but say pharmacists, physios, to broaden the scope with which they provide their services? I know there's a trial in Queensland where pharmacists have been empowered to diagnose and treat a range of conditions. Is that something the AMA supports as well?
So we maintain that GPs are the cornerstone of our healthcare system and are the centre point of patient care and clinical leadership. We know that Australians trust that valuable relationship with their GP. In terms of pharmacy prescribing, we don't agree that the Queensland trials are the best use of healthcare dollars or the best pathway for patients to gain access to complex medications. But certainly we support working in teams together and we do have models for pharmacists working in general practice to provide that key medicines expertise. But certainly we'd like to see that working more as a part of a team where everyone works to their breadth of scope. But GPs are maintained central to that role so that patients have that one point of contact as the coordinator of their healthcare information.
Is bulk billing the way it's operating now, is it sustainable? I know that it's certainly not universal, but is it sustainable?
I think your viewers will know that over the past many years, and particularly over the past couple of years, the Medicare rebate back to patients just hasn't kept pace with the cost of providing high-quality comprehensive care. So GPs have increasingly struggled to keep their doors open, provide that care to patients at a low or no cost. So we are seeing the cost of consultations increase and the out-of-pocket costs to patients rise. So the government does need to step in here to make general practice more affordable to patients. And that's where we see that we need some short-term action to make sure that we can continue to provide care, particularly to our most vulnerable patients.
When you talk about that issue that we mentioned earlier, the trial of empowering pharmacists to diagnose and treat certain conditions, that's actually, it's not public funding that supports that, is it? That's the private sector. So doesn't it make sense to capitalise, use as much as we can our capacity within the private sector to then complement what's being done via Medicare and general practice?
So you're right that in most cases it is private money that is being put to that, but in some cases, such as Victoria, there have been some government commitments towards such trials. And I think patients will understand that GPs have been through decades of medical training to be the experts in combining complex health information, so taking that patient history, usually performing an examination, diagnosing the condition that's there, performing some tests in the consultation room to make sure whether a medication is really needed at all, and then whether to continue an existing medication or make changes, remembering that medicines are only part of the solution to many healthcare problems. So for the GP, they're providing that breadth of clinical expertise is we see much better value for the patient in maintaining people's healthcare.
So to drill it down, basically the rebate needs to be increased and flexibility given to practitioners in terms of the way that service is delivered. Is that a fair way to describe it in terms of the
Exactly.
AMA?
We think we need increases in patient rebates and a rebalancing so that patients who need a longer consultation get an adequate rebate for that. And on top of that, we need some flexible funding to help employ additional healthcare staff to provide that breadth of healthcare to people, particularly with chronic diseases.
Dr. Danielle McMullen, Vice President at the AMA, thanks for your time. Appreciate it.
Thanks.